When we talk about photofacials or light therapy treatments, we're talking about kind of a generic group of IPL or intense pulse light. Cyton is a company that specifically makes the BBL or the BBL Hero. BBL, not Brazilian butt lift, but broadband light, is a specific wavelength of light. We use different filters to target either oxyhemoglobin or melanin in the skin. What makes the BBL Hero is the high energy rapid output of the treatment. So previously, in a lot of IPL kind of older devices or maybe off-brand devices, they pulse one time, maybe every few seconds. The BBL Hero is very quick. You can move very quickly. So let's say a back, which would normally take maybe 20 minutes, you could treat a full back in like 2 or 3 minutes. So you can treat areas much quicker, especially body areas much quicker. It also makes the treatment much more comfortable, that it's firing much faster. So, some people, they're used to numbing before IPL or BBL treatments. We do not routinely numb our patients. We've had multiple patients that have fallen asleep during our BBL treatments. But BBL, specifically the BBL Hero, high energy rapid output, is used for redness in the skin, broken capillaries. It's used for hyperpigmentation, whether that be from freckling or sun damage. We usually try to avoid it for melasma, but sometimes we will in specific patients use an energy device like the broadband light for melasma as well. For the BBL Hero, we would routinely recommend anywhere from 3 to 5 treatments to get started. So if a patient's biggest concern is more pigment in their skin, we often will recommend 3 treatments, 1 a month. And then for maintenance, we usually recommend 2 or 3 a year. If it works for a patient's beauty budget, they may want to do 1 quarterly, but potentially leave off the summer, as we need to make sure that their skin is closest to the baseline that the color of their skin is in the winter. If someone has a concern of redness, the oxyhemoglobin in the skin, that is a little bit more difficult to treat, a little more persistent. Redness, broken capillaries, unfortunately, just take a little bit longer to respond to the broadband light. So routinely we would recommend 5 treatments, 1 a month for 5 months. And then we would reevaluate and determine, best course of treatment at that point. But routinely we would recommend then maintenance similar to hyperpigmentation of whether it be quarterly, 2 or 3 a year, maybe leave off the winter.